Your ability to have an orgasm after having had your womb removed shouldn't be impacted. If you're thinking of having a hysterectomy or have had a hysterectomy, I'm going to do a series of short videos of common questions I get asked about sex after having had a hysterectomy. Now, I'm going to say that I'm not an expert in this area. There are so many of my incredible colleagues that have done so much incredible work around this. However, as a clinician who deals with this in a day-to-day work, if I'm singing from the same hymn sheet, I'm hoping we can reduce the stigma and the shame around this. Now, if you're having a hysterectomy and your surgical team or your doctor team have not discussed sex after having a hysterectomy, please don't be shy. Ask all the questions. If you need to write them down, it might be that you need to go together as a couple, because having a fulfilling sex life after surgery, regardless of what reason the surgery has been done, is such an important area of medicine and also your well-being. So for those of you new to my page, a hysterectomy is the removal of a womb, and also if you're going to have your ovaries removed, that's an oophorectomy. And then also some people end up getting the cervix removed at the end of their womb. In this video, I'm talking about vaginal intercourse after you've had a hysterectomy, so the womb has been removed. Non-coital intercourse, such as masturbation, oral sex, and using sex toys after having a hysterectomy is usually not impacted, and there's a whole other content that you can look at around that. So firstly, if you're having a hysterectomy, then you need to be talking about low-dose topical vaginal estrogen to be used in and around the vulva and the vagina as well, and then also creams that can be used around the perineum and the back passage as well. You also need to be talking about localized vaginal moisturizers, so ones that don't have glycerin in them, because if you're prone to getting thrush, then that will mean that it will be okay to use in and around the vulva and the vagina. The good news is most women who have had a hysterectomy, for whatever reason, actually their sexual pleasure and well-being improves because symptoms such as pain and vaginal bleeding are reduced after having had their womb taken out. So how soon can you have sex after having had a hysterectomy? Well, many gynecologists recommend 4 to 6 weeks, but generally 6 weeks if you've had your cervix, so that's the bottom of the womb, that's been removed, as it needs more time to heal. However, this advice can vary from different gynecology departments, so please listen to your surgeon who's doing the operation. Some doctors, some surgeons advise 12 weeks after having an abdominal hysterectomy because that takes longer. Also, laparoscopic hysterectomies or radical laparoscopic hysterectomies, they might need longer. Your ability to have an orgasm after having had your womb removed shouldn't be impacted. That's mainly because the clitoris that's there is not impacted when you're having a hysterectomy. But the intensity or the quality of the orgasm might change, so it's well worth exploring ways that you can manage that. I hope that's been useful. Please leave any questions down below.